Multiple news publications report that European drug safety regulators are investigating whether popular weight loss and diabetes drugs called GLP-1 agonists, brands like Wegovy, Ozempic, and Saxenda, whether they significantly increase the risk for suicidal thoughts and attempts. Apparently, they're investigating 150 such reports. Rightly so, this has been getting lots of media attention. Now, the drug manufacturers deny any link, claiming that the initial studies didn't show any increased risk. But here's the crucial point to understand. The studies of GLP-1 agonists for diabetes management or for weight loss excluded anyone with a history of suicide attempts or any diagnosis of bipolar disorder or schizophrenia or a history of depression within the past 2 years. So it's no surprise that these trials didn't show an increased risk in suicide attempts as they involve populations that were low risk. Now, as the drugs have gotten into the real world, it appears that they may increase this risk. And this raises the issues and problems when, prescribing clinicians stray from strict inclusion and exclusion criteria, as happens in the real world. But this is obviously very serious. It isn't like a side effect of high blood sugar or high cholesterol, which can be monitored and treated. Suicidal ideation is very different and much more serious. So based on the risk in the ongoing investigation, it seems clear that anyone with a history of depression, bipolar disorder, or schizophrenia with or without suicidal thoughts should avoid GLP-1 agonists for the time being. There's no reason to use GLP-1 agonists in a psychiatric population as there are excellent options for weight loss and blood sugar control. Notably, ketogenic therapy is one, but they can also provide a similar benefit for patients without the potential increased risk. And an added benefit is that emerging evidence demonstrates that ketogenic therapy can also help treat the underlying psychiatric condition. So if you have a psychiatric diagnosis and are taking a GLP-1 agonist, please talk to your doctor immediately about whether you should stop it and whether you might replace it with ketogenic therapy or another intervention. Our video with David Ludwig describes how low-carb regimens like keto actually work in a similar way to these drugs without the risks. And if you're having suicidal thoughts, of course, talk to your psychiatrist immediately or get to an emergency room. We will certainly hear more about this issue as investigations unfold, and we will share more on this channel. So stay tuned to us here at Metabolic Mind.